And welcome to this channel on men's health and neurology. This is the second part of the treatment of impotence or erectile dysfunction. In the first part, I had considered oral treatment methods and conservative methods, as in lifestyle changes in the tablets which can work, and in cases which have a more severe defect or have very severe psychological overlay, they will not respond to the tablets. And then comes in the second step, that is the intrapenile injection. This intrapenile injection directly acts on the penis, so that in patients with severe psychological overlay, those whose connection between the psychological centers and the local penile centers is a little astray, this intrapenile injection acts in a very low dose and it has a significant erection because the psychological overlay is overcome. And in those with vascular causes, as I had said, due to diabetes or hypercholesterolemia, and who have a severe defect, as in the blood supply to the penis has become narrow, in this case, and the nitric oxide production has decreased. In this case, also the intrapenile injection, which is a combination of drugs, acts not only to increase the blood flow but also to retain the blood flow for a longer time to have a sustained erection. But when you hear about an injection to the penis, the mind itself becomes a little scared. Injecting something into the penis, oh, that would be very scary. But I will show you by the end of the talk that it is not very scary and it is a very good treatment option. Very good treatment option for patients with moderate erectile dysfunction, and with this they can achieve a natural erection, as good as a natural erection. So the injection, most important thing to understand, is done with a very fine needle. So this is the BCG syringe used for by diabetics for injection of insulin. So you can see it is very fine. Yeah, the tip is hardly visible, so it's not going to be painful. That is the first thing to keep into mind. And when we inject it into the penis, it is not very painful. Only initially the technique has to be demonstrated, and after that can be done easily. So this is a fine needle, and in this fine needle is injected into the penis. So now for the penis, I have a banana here, but this is the penis, and there are two tubes. The penis has just two tubes, one on each side, and there is the urethra below. So the injection has to be done on either side or into these tubes. These tubes have these sinusoids, which the sinusoids retain the blood, and then for the penis becomes erect. When they lose blood, the penis becomes flaccid. So then this injection has to be generally be given into these. See, it's a fine needle, just goes in. So when we give pre-filled syringes, so they are pre-filled, and these pre-filled syringes have to be just injected on, if you see, in the sides, here or here. After injecting, it's a small needle, and it's a very simple procedure. And then by holding it for 10 seconds, the procedure is done. So there are these two tubes where it has to be injected on either side. One can inject one side, one time on this side, one time on the other side. And one has to be careful not to inject in the center, because there are no tubes in the center which hold the blood, and not below, because there is a urethra. So importantly, this is a very ultrafine needle. Importantly, this is a very ultrafine needle, and it does not cause too much pain, nor it causes any bleeding, and it acts locally on the penis. So the advantage compared to the tablet is this: when this injection is taken, it acts within 10 minutes. So it is spontaneous thing, and if one has the injection at home, it's a spontaneous decision. Taking the injection, if the patient stimulates, again this cannot cause the erection on its own, though it is more potent compared to the tablets as it acts locally. So after taking the injection in the toilet, the patient can then within 5 minutes start stimulating and doing foreplay, and there will be a good erection, and he'll be able to complete intercourse if it is effective. So the benefit compared to a tablet is that it acts locally and it acts quickly. Secondly, there are no side effects. The tablet has a few effects which I had explained, because it increases the blood flow to the entire body, so it causes warmth, sometimes mild headache, and blurring of vision sometimes with particular tablet, or muscle pain in another particular tablet. So these are overcome by this injection because there are no side effects, because it acts locally in the penis. And so what these injections come in different formulations. Either there is only single drug which is not very effective. So what we use is a dual drug preparation, what is called as a Bimix. It contains a papaverine and another drug which is a alpha blocker, that is in medical terms. So this papaverine, which causes increase in the blood flow towards in the penis, and it causes vasodilation of the penile vessels. And the other drug, which is alpha blocker, that it causes a relaxation of the smooth muscle so that it can retain blood. So these two in combination have a very potent effect. and the doses range from very small dose, minute dose, as you can explain in this minute dose. Only minute dose will be only till this mark, so it will be, that will be 0.1 ml, and then it can be increased up to 1 ml. So the dose and the composition and the concentration has to be decided by the andrologist depending on the degree of problem or degree of the disease or the degree of erectile dysfunction the patient has. One has to start with the low dose in the clinic, with first injection being done by me, and then the patient seeing the first injection, being comfortable with it, then stimulating and seeing the erection, and then the second time he does it with the help, and by the third setting he can do it by himself, he's comfortable, and that is when we fix the dose, because we start with the low dose and go on to a higher dose. Because if we give a too high dose initially, there will be a prolonged erection, which is called as a priapism. This prolonged erection can be very painful, mind you, and this is defined when it is lasts for more than 4 to 6 hours. Even after the patient ejaculates, the erection can be prolonged, so it has to be done with caution under supervision of an andrologist initially, so that the technique is three things: so that the technique is confirmed, the dosage is fixed, and in case the patient knows what is if there is a prolonged erection, that he has to report immediately, and he becomes comfortable with the entire procedure. So in this way, if the technique is proper and the dosage is correct, it is a very successful method of attaining a near normal erection even in patients with severe to moderate erectile dysfunction or impotence. So there are different preparations, as I said. Bimix, there is Bimix is a very simple one and does not require refrigeration. I meant refrigeration in the fridge. It can be kept in a cupboard at room temperature, and its shelf life is up to 3 months. Whereas there is another more potent combination which is even more expensive also, because it contains prostaglandins, and it is called as a Trimix. Trimix contains 3 drugs. The one I mentioned, which is increasing blood flow, second is the muscle relaxant, and the third is a prostaglandin, which again relaxes the muscles even further, retaining blood. So this prostaglandin is a little expensive, but it requires refrigeration at a temperature of 2 to 4 degrees. So this is even more potent. So it has 2 effects. That is, it requires 2 problems. That is, requires refrigeration, and sometimes it can be painful. So the dose and concentration has to be adjusted. So this dosing concentration is obviously the clinical acumen of an andrologist, from what dose to start and how to titrate the dose to a perfect dose, so that the patient does not have to inject too much and it does not cause prolonged erection. If too much dose is injected over a long period of time, maybe it might not cause prolonged erection, but it can cause fibrosis or thickening in the penis. So this is also very important. And this preparation has to be made by mixing it in an appropriate combination, and which is generally done by a urologist and andrologist who is trained particularly in giving these intrapenile injections. Once a dose has been fixed, the syringe will be given to the patient in a pre-filled syringe along with a spirit swab in a plastic packet, so that every time we can use that one plastic packet whenever he needs, use the needle, and mind you does not use it again, bends it and discards it, and there is a fresh spirit swab for every time. So this makes it very convenient for the patient. He can keep it in the cupboard and use it, and he can even transport it wherever he wants whenever he travels, and this can be very useful in patients' need, and that can give you a very natural erection compared to those achieved with a prosthesis, which I will discuss ahead. So if one has a decent amount of moderate disease and he succeeds with the injection, he gets a good natural erection, and hence his sexual life will obviously change, because previously he did not have enough good erections even for intercourse. It will give him natural erections and he'll be able to succeed with intercourse. So those who succeed with lower dose have a milder disease, and higher dose have a more severe disease. Proper technique is important, and a proper 2 to 3 visits with an andrologist will be effective. And which drug to choose is also a patient's choice, whether he has to travel with it, whether he has to refrigerate it, and it has a decent shelf life. So it has been very successful in many of my patients. I hope this was very informative video regarding intrapenile injections as a therapy for impotence or erectile dysfunction. If any queries are there, you can write in the comment box, or you can see further details in the website in the description. Kindly like and subscribe the channel and like the video. And I will further cover the third type of treatment for impotence in the next talk, that is penile prosthesis. That will be in detail. Maybe I'll split it up into many parts. The next will be penile prosthesis. Thank you, and like and subscribe.